Hello everyone, I am Dr. Sreekanth, consultant nephrologist, Care Hospitals, Malakpet. Today I am going to tell about our state-of-the-art dialysis unit at our center. So as you all of you know, end-stage renal kidney disease patients. So the ideal modality of treatment for them is dialysis. Dialysis, most of the time the patients have to come for the hospital around 2 to 3 times a week, and the patients will be spending around 4 to 5 hours in each session in the hospital. For that, we need to maintain the dialysis unit in a very proper, standard way. So, coming to our unit, so here in our unit, we will be providing the various dialysis modalities. The first one is hemodialysis. So, as you all of you know, hemodialysis is one of the main modality for CKD patients. So, we have advanced and state-of-the-art infrastructure here, where we are providing high quality, safe and personalized care to our dialysis patients. So, apart from hemodialysis, we have SLED dialysis modality, that is Sustained Low Efficacy Dialysis, where the hemodynamically compromised patients will be provided the dialysis services. The other advanced dialysis modality is CRRT, which stands for Continuous Renal Replacement Therapy. We have a state-of-the-art unit here. We provide CRRT services also. CRRT mode of dialysis used in patients with hemodynamic instability, who have low blood pressures, who have cardiac conditions, who have neurological conditions. In this set of patients, CRRT modality is used, where the patients requires continuous, the dialysis will be provided around 24 hours to 48 hours, in some cases up to 3 days. These patients require CRRT mode of dialysis. We do have good CRRT machine here, where we are providing international standard care to our patients. Coming to the unit, we have standard RO plant. For dialysis patients, we need to have standard water quality. For that, we have a good quality, high quality RO plant, where we are maintaining AMI standards for the water quality, where we continuously check the water quality for chemical, bacterial and endotoxin contaminants. We regularly check the water quality, and we strive to provide high quality water to our patients. Because the dialysis patients are exposed to around 300 to 600 liters of water in the form of dialysis every week, we need to maintain a good high quality water standards, which we are doing in our center. Infections are most common in dialysis patients. For that, we need to take strict measures to control infections. So here in our unit, we maintain good hand hygiene, we maintain proper catheter care, and we, as said before, we maintain high quality water, and we have a very qualified technicians and nurses who take care of these patients continuously 24/7. Coming to the dialysis standards and dialysis prescription, as I said before, we provide personalized care to every patient. As a nephrologist, I oversee prescription of each and every patient, where I try to maintain proper dry weight of the patient, where I try to maintain avoid the intradialytic complications to the patients, and I oversee every patient's heparin protocol, which is very much important to the patients. So what I meant to say is, we are trying to provide high quality, safe and personalized care to our patients here in our Care Malakpet unit. As all of you know, dialysis is an expensive procedure where few patients are not able to afford. So for that, we do have in our hospital, we are providing services to CGHS patients, Aarogyasri patients, and all insurance patients. We are providing services here. If any of your family members or friends are suffering with kidney diseases who are requiring dialysis support, so please come and try to take our services, where Care Hospitals will ensure that you will be given the best possible care to your family members and friends. Thank you.